Let me ask you something personal. Do you know someone who turned 80 and within a year or two seemed to change almost completely? Maybe it was a parent, a grandparent, a neighbor you've known for decades. They used to move through the house with energy. They remembered every birthday, every little detail. And then something shifted, quietly, gradually. And everyone around them kept saying, well, that's just aging. But here's what nobody told you, and what I spend a significant part of my practice explaining to patients and their families. Aging is not one vague, uniform process. Once a person crosses that 80-year threshold, there are 5 very specific, very predictable physiological changes that the body goes through, and they happen to virtually everyone. Not because something has gone terribly wrong, but because the human body, as extraordinary as it is, begins a different chapter at 80. Understanding what those changes are, and more importantly, what you can actually do about them, is what today's conversation is all about. I'm Dr. Mia Walker, and if you're here watching this, I suspect you care deeply about either your own health or the health of someone you love. So let's talk about this honestly, clearly, and with the kind of detail that actually helps you make smarter decisions. Before we get into it, I want to say one thing. None of what I'm about to share is meant to frighten you. Knowledge is never the enemy of well-being. The people who struggle most with aging are the ones who were never told what to expect. So we're going to change that today. The first thing that happens once you turn 80 is something called sarcopenia, and it accelerates dramatically after this age. Now, sarcopenia simply means the progressive loss of muscle mass and strength. We all lose muscle as we age. That process actually begins in our 30s, but the rate at which it happens after 80 is in a completely different category. Research tells us that after the age of 80, some individuals can lose up to 3 to 5% of their muscle mass per year if they're sedentary. And the consequences of that are far more serious than most people realize. It's not just about feeling weaker or having trouble opening a jar. Muscle is what keeps you upright. It's what prevents falls. It's what allows you to get up from a chair independently. Muscle tissue also plays a crucial role in regulating blood sugar, managing your metabolism, and even supporting your immune function. When someone at 85 falls and breaks a hip, the fracture often gets the blame. But in a large number of those cases, the deeper issue is that the muscles that were supposed to catch that person before they hit the ground simply weren't strong enough anymore. So what do you do with this information? The answer, and this might surprise you, is resistance training. Gentle, consistent, safe resistance training is one of the most powerful interventions we have for this age group. That doesn't mean lifting heavy weights at a gym. It can mean resistance bands. It can mean chair-based exercises. It can mean working with a physical therapist once a week. The key is consistency and progressive challenge, even at a gentle level. And protein intake matters enormously here too. Many older adults are actually significantly under-eating protein, which speeds up muscle loss. If you or your loved one is over 80, this is a conversation worth having with your doctor immediately. The second change, and this one surprises people every single time I bring it up, is what happens to the kidneys. Your kidneys are extraordinary organs. They filter your entire blood supply dozens of times every single day. But after 80, kidney function often declines in ways that are quiet, largely symptom-free in early stages, and yet profoundly important to understand. The kidneys become less efficient at filtering waste, less capable of regulating fluid and electrolyte balance, and significantly more sensitive to dehydration and to medications. That last point about medications is one I cannot overstate. Many people over 80 are on multiple prescription medications. This is quite common and often medically necessary. But the kidneys are responsible for clearing many of those drugs from the body. When kidney function declines, drugs can build up to higher concentrations than intended. A dose that was perfectly appropriate 2 years ago may now be too high because the kidneys can't process it the way they once did. This is one of the reasons why medication reviews are so critically important in this age group. If your parent or grandparent is over 80 and hasn't had a comprehensive medication review in the past year, please advocate for that. Dehydration is another critical piece of this puzzle. The kidney changes at this age combine with something else that happens: a reduced sensation of thirst. Older adults, particularly those over 80, genuinely feel less thirsty than they are. The body's thirst mechanism becomes less reliable, so they drink less, the kidneys are already working harder than they used to, and dehydration can escalate quickly into something serious. Confusion, dizziness, falls, urinary tract infections, and in severe cases, acute kidney injury. The practical takeaway here is simple but profound: scheduled fluid intake. Not waiting to feel thirsty, but drinking water at set times throughout the day. It sounds almost too simple to matter. It matters enormously. The third change is one that affects the brain, and I want to be very precise about what I'm saying here because this is an area where people either catastrophize or dismiss, and both responses are unhelpful. What I'm talking about is not Alzheimer's disease. What I'm talking about is the normal, expected slowing of cognitive processing speed that happens in the majority of people over 80. The brain, like every other organ, undergoes structural changes with age. The volume of the brain gradually decreases. The white matter, which is essentially the wiring that connects different regions, can become less efficient. The result is that things take longer. Retrieving a word takes a fraction of a second longer. Switching between tasks requires more effort. Learning something new takes more repetition. And here is where so many families go wrong. They interpret this normal slowing as the beginning of dementia. They start talking around their loved one, finishing their sentences, taking over tasks, and what that does is remove the very mental stimulation that the brain needs to maintain its function. The brain, even at 85, even at 90, retains something called neuroplasticity, the capacity to form new connections and adapt. It just needs to be challenged. Social engagement, reading, puzzles, learning a new skill however modest, having real conversations about real topics. These are not soft, feel-good suggestions. They are neurologically meaningful activities that research consistently shows can help preserve cognitive function. Sleep also plays an enormous role here, and sleep changes dramatically after 80 as well. The architecture of sleep shifts. People spend less time in the deeper, more restorative stages of sleep, and poor sleep has a direct, documented impact on cognitive function and on the clearance of certain waste products from the brain. If someone over 80 in your life is sleeping poorly, that deserves medical attention. It is not just an inconvenience. The fourth change is what happens to the cardiovascular system, and specifically the walls of the arteries and the heart itself. Over decades of life, the arteries naturally become less elastic. They stiffen. The heart has to work harder to push blood through a less flexible system. This is why isolated systolic hypertension, where the top number of the blood pressure reading is elevated but the bottom number is normal or even low, becomes so common after 80. It's a direct reflection of arterial stiffening. The heart muscle itself also undergoes changes. It becomes less responsive to stress and exertion. The maximum heart rate an individual can achieve declines. Recovery from physical activity takes longer. And the electrical system of the heart, which governs its rhythm, becomes more susceptible to disruptions, which is why atrial fibrillation, an irregular heart rhythm, is so much more common in this age group. None of this means that an 80-year-old is destined for heart failure or a stroke, but it does mean that blood pressure management becomes even more important and simultaneously more nuanced at this age. There's actually compelling evidence that in the very elderly, being too aggressive about lowering blood pressure can be just as harmful as letting it run too high. This is one of those areas where individualized medical care is genuinely essential. A blood pressure target that's right for a 55-year-old may not be right for someone who is 83. Please make sure the doctors involved in your loved one's care are having those individualized conversations. The fifth change is one that almost nobody talks about openly, and it involves the immune system. After 80, the immune system undergoes a process that immunologists call immunosenescence, essentially the aging of the immune system. The production of new immune cells slows. The existing immune cells become less effective at recognizing and responding to new threats. Vaccines produce a somewhat weaker antibody response. Infections that a younger immune system would handle quickly and without drama can become serious and prolonged in someone over 80. But there's another dimension to this that's equally important and often overlooked. The aging immune system doesn't just become weaker at fighting infection. It also becomes more prone to a state called chronic low-grade inflammation. This is sometimes called inflammaging in the scientific literature. It's a background hum of inflammatory activity that doesn't cause obvious symptoms, but that contributes over time to the progression of many age-related conditions: cardiovascular disease, cognitive decline, diabetes, and others. What can you do about this? Nutrition is one of the most powerful tools we have. A diet rich in vegetables, fruits, healthy fats, and lean proteins supports immune function and helps regulate inflammation. There are also specific micronutrients, vitamin D, zinc, and vitamin B12 in particular, that are commonly deficient in adults over 80 and that have direct implications for immune function. Again, this is worth discussing with a physician and getting levels checked through a simple blood test. Vaccination is also non-negotiable in this group. The influenza vaccine, the pneumococcal vaccine, the shingles vaccine, and updated COVID boosters are all recommended for adults over 80, because the immune system simply cannot mount the same self-protective response to these illnesses that it once could. Now, I want to take a moment before I close to say something that I believe with every part of my clinical experience and my personal values as a physician. 80 is not the end of a full, meaningful, joyful life. I have patients in their 80s who travel, who garden, who mentor young people, who fall in love, who start new creative projects. What makes the difference? Consistently, reliably, across every patient I have ever cared for, is awareness and preparation. The people who thrive at 80 and beyond are not the ones who got lucky with genetics alone. They're the ones who understood what was coming, adapted thoughtfully, stayed engaged with their health, and had people around them who were informed enough to help. That's why conversations like this one matter. That's why I make these videos. Because a few minutes of the right information, shared with someone who genuinely cares, can change the quality of years, maybe decades, of someone's life. So if this video helped you today, I'd encourage you to share it with someone who needs it. A family member who's approaching this age, a friend who's caring for an aging parent, anyone who would benefit from understanding these 5 changes more clearly. And if you have questions, leave them in the comments below. I read them and I use them to guide the topics I cover in future videos because your questions tell me what you actually need. Take good care of yourself and the people you love. I'm Dr. Mia Walker, and I'll see you in the next one.